Hello everyone, thank you all for coming to the Alumni Panel. So we're gonna present Dr. Tiffany Wu and Dr. Hannah Kim to this Alumni Panel. First, I would like to introduce you all for Dr. Tiffany Wu. She's currently doing her pharmacy, PGY1 pharmacy resident at Rush. And the next slides will be Dr. Hannah Kim. She is currently doing her PGY2 rotations at UIC at the emergency medicine unit, and she had her PGY1 experience at UIC as well. Going to the next questions that we have for the panelists, we would like to ask, can you go over your pharmacy journey and how you got to your current position?
Okay, well, hi everyone. My name is Hannah Kim. I'm currently a PGY2 in emergency medicine at UIC. Like Chi mentioned, I also did my PGY1 at UIC as well, and then I also went to pharmacy school at UIC. So it's been total happy 6 years at UIC. So first question, my pharmacy journey and how I got to my current position. So I went to undergrad in Ann Arbor, Michigan, and then came here for pharmacy school. I worked throughout my whole 4 years of pharmacy school at Walgreens. I also worked at Jesse Brown inpatient side. And then I decided to do residency, and I solidified that decision as a P4 student during going on rotations. And then, you know, going through forecasts and interviews and everything, I decided to stay at UIC, which I'll talk about more in later questions, but that's how I got to here. And then I fell in love with emergency medicine, so I became a PGY2 emergency medicine at UIC.
So for me, I forgot about this actually, but like Hannah, I also went to undergrad in Ann Arbor, U of Michigan. Got my microbiology degree there, so I kind of knew coming to pharmacy school, I was very interested in infectious diseases. So then, got into UIC Pharm School, started working with Dr. Wensler, who, if you guys haven't met yet, you guys will. He did infectious diseases. So I started working with him all throughout my 4 years in pharmacy school, and then also worked at Walgreens as well. And then I basically knew I wanted to become some type of clinical pharmacist going in. Going into school, I wanted to be like infectious diseases clinical pharmacist. And now that I'm here at Rush, I'm kind of juggling between emergency medicine versus infectious diseases, but I think I'm still leaning towards the ID route.
The next question we have is, what's your typical work routine?
So right now, I just started my emergency medicine rotations. It's a lot different than all the previous ones I've had, and I'm sure Hannah can speak to this as well. So emergency medicine, basically my work routine is I don't have any patients to work up, which has been amazing. And so this week, my schedule Monday, Tuesday, Wednesday, I basically start at 1 to 9:30, and then the next week I start at 8 to 4:30. And then like I said before, I don't work up patients, but that's just I think ED specifically. So you're kind of just really fast paced, you're just kind of thinking on your feet a lot, you're facing a lot of a variety of different patients at any given moment. And so that's kind of where I'm at right now. My previous rotations have been on gen med and infectious diseases, and those, my typical work routine would be I wake up at 4 a.m. to work up my patients. Usually the workload right now is about 15 to my max has been 23 patients. So I wake up at 4 a.m. kind of my rounds started anywhere between 8:30 to 10, depending on your team. Rounds usually last 1 to 2 hours. And then afternoon, you kind of finish up your patient progress notes or anything you need to follow up on. And then there's a gazillion amount of projects to do in your downtime. So there's not really
downtime. As a PGY2 emergency medicine, I've been in the ED setting until now, but then I started NICU rotation. Our rotation as a resident is 4 weeks. I know students is 6 weeks, so it's shorter for us. In the NICU setting, kind of like Tiffany said, we work up patients. As a PGY2, because I'm just more familiar with, patients and disease states, I can't wake up at 4 to work up patients, but I try to wake up or at least around like 6:30 to work up patients. But yeah, so we do work up patients in the morning. We round at 8. Rounds, depending on who the attending is, can last 3 to 4 hours, and depending on how many patients you have in that unit. So it'll end around like lunchtime, 12 p.m. You touch base with the team, you follow up with whatever you need to do to follow up. And then usually I get out around like 3 p.m., but I also have, other non-rotation related work like research that I have to do, seminars, teaching, and those kind of stuff that I utilize my time after rotation. In the ED setting, because I'm an emergency medicine, just wanted to talk a little bit more about that. Like Tiffany said, there's really no working up patients. You show up when you're supposed to show up. So it's from 8 to 5 at UIC. But even after work, there's really no like following up in the ED, which I loved. And that's one of the reasons why I chose emergency medicine. But like Tiffany said, ED is great because you get to work up pediatric patients to, older population patients, even like, infants might show up in your ED. And that's really interesting. Trauma patients, which UIC don't really have, but in, trauma level 1 setting, you will. So yeah, those are typical work routine as a PGY2 now.
Okay, the next questions we have is what are your primary responsibilities?
I mean, kind of like just on the basic level, just making sure like I'm contributing to my team in terms of like making sure the patients are getting like the right medication at the right dose. Like a lot of times here at Rush anyways, like the pharmacist's opinion is really utilized. So I get asked a lot of questions like, oh, what's like the duration of therapy, or what would you recommend? If like a lot of times I would try to have like and besides just like the first kind of like recommendation, I also have backup ideas for the team, because a lot of times if they're like, oh, like looking for alternatives, and so I'll try to have like at least 3 options for the my team. But basically my main responsibility is just knowing the drugs, and then knowing the patients, and then like applying like my clinical knowledge to them.
Yeah, I think the primary responsibility as a resident changes when you're a PGY1 to a PGY2. As a PGY1, like Tiffany said, it's mostly you will have your preceptors around you most of the time. So if you have any questions, you would ask the preceptor. The preceptor might want to pre-round with you before you go to round, so you have some solidified recommendations. You might run by yourself as a PGY1, but you still have to touch base with your preceptor to tell them like, hey, this is what I recommended, or did I do this right? Do you have any other recommendations? So you do have a close relationship more as a PGY1 with your preceptor. Now when you become a PGY2, your responsibility changes. So you rely on your preceptor less. Of course, this really depends on your comfort area of your rotation. Like for me, NICU and ED is my comfort area. I'm used to like critical care management, so I rely less on my preceptors on all the recommendations that I make. But to be on the safe side, I do work up my patients. I do read primary literature to back up my recommendation. So I'm pretty confident in my recommendation that I rely less on my preceptor. Another primary responsibility as a PGY2 is teaching. UIC is a teaching hospital, so we have a lot of students. I also have 13 of PGY1s that, round for each of my rotations. So teaching is definitely something that PGY2s get a lot. We become their primary preceptor, so we give them feedback. We lead topic discussions with them. If they have any questions, I'm their primary person that they'll reach out to for questions instead of reaching out to the preceptors. So I think there's a huge difference between, a primary responsibility as a PGY1 and a PGY2.
Thank you. So the next question we have is, what's the one challenge you have experienced in your position, and what did you do to overcome it?
And a lot of challenges. as a PGY1. Oh my gosh, maybe it gets better as a PGY2, but definitely one challenge is when you start from the first day of just orientation, it's information overload. You are like, there's just so much to do and learn. The learning curve is really steep. They throw you in no matter how much, like, there's a lot of support here at Rush. And I'm not saying like I can't like approach like any one of like my preceptors, pharmacist, staff, but there's like this learning curve is steep, especially in the first like 2 months. You are learning like staffing responsibilities. Your like your clinical knowledge is being tested. You have a research project that you need to choose, and the MUE projects you also need to choose. And then on top of that, like so Rush has like weekend staffing, so I couldn't touch base on that, but there's also like weekday staffing, and then like UIC we have like our on-call component. So it's just a lot thrown at you at once. And so I think it just mainly kind of like it's a big umbrella, but like one challenge is kind of like information overload at one time, and you just really need to learn how to manage that and learning how to manage the stress that's thrown at you kind of like all at once. And so for me, I'm not someone that gets stressed out like too easily, and I like to work really last minute, but I've had to work not as last minute, if you kind of understand what I mean. I actually have to plan it out a little bit more now. But definitely keep an open mind on things. And like, if you don't know anything, I know like people have said it many times, you don't know, just ask. But really here with like your license on the line, if I am unsure about anything, I like call up like different clinical pharmacists just to have different like opinions and see what they like are telling me, what they say, so then I can like make the best, clinical decision. So definitely, yeah, keeping an open mind, having a good attitude about things. And I don't know, just like take every day as like a good as like a learning day, really. Because I'm at this point where I am right now, I'm kind of only like 4 months in. There's still a lot I don't know. There's still a lot of stressors coming in my way. I'm just starting essentially my research project data collection. So there's like a lot going on, but I just kind of take it day by day, and I don't get stressed out too much. And yeah, I just like think of it as like attitude of gratitude. I'm really happy to be in this residency program this whole year just for me to learn. And so I'm just gonna like use it to my advantage and just learn as much as I can. Yeah.
Tiffany, I promise it will get better. It will.
I'm sure.
As a PGY2, the one challenge that I'm experiencing is kind of where Tiffany said that if you have any questions as a PGY1 or as a student, you would normally reach out to your preceptor and ask for their recs, right? Like, hey, I have this patient that I have no idea what I should do. What are your thoughts on it? As a PGY2, that is the challenge for me because people really look at me as their primary pharmacist in the team. My preceptor is not there. So they look at me as their primary pharmacist, and students are looking at me as your preceptor, and PGY1 is looking at me, thinking that I know what I'm saying, but in the side, do I really know what I'm saying? Like, see, that's the challenge right there. I do, looking up primary literature, I look at guidelines, I look at all these things before, I solidify my recommendation, but is this really the right recommendation to make? Is there any other alternatives? I think those are the challenges that I continuously have as a PGY2 where, like, are there anything else? Am I missing anything? Was this the right choice? So I think, when I'm done with this year, I'm really going to be a clinical pharmacist that people will really look at me as their primary pharmacist, and I'm not a resident anymore. So I think it's that step of like what do I need to do what can I do better to become, am I ready to become a clinical pharmacist? Like, am I really ready to take on this pharmacist role? I think I'm in that struggle zone right there where I think I know more than a PGY1, but then I don't know, like, if I can really become, and do I feel confident to become a clinical pharmacist?
So the next question we have is, what experience in school helped prepare you for what you do today?
I feel like because practice changes so often nowadays, guidelines continues to be updated. Things that we learn in school in terms of lecture-wise can get outdated. So I think at school, it's more of like learning how to look up information. I think DI, when I was a student, I didn't think DI was as important, but as a resident, I think DI is actually something that I should have really looked into, like how to search PubMed or like how to use different resources to get to the right information. I think in terms of academic wise, I think it's really learning about how to look up information. I think that's the most important thing. However, there's so many other things that UIC offers, right? There's so many organizations, which I think is super helpful. I think as a student, I think it's important to be involved in organizations. I think APA is great because I do have a strong passion for Asian population and reaching out to Asian like community people. So getting involved with organizations, trying to figure out what you like through organizations. And really, if you can, taking a leadership role is also great to practice your leadership skills. I think UIC is great and offers a lot of organizations. What else? I think outside of school, having a job is also important, just to figure out if you really like the community setting, or if you really like a hospital setting, if you work in an inpatient hospital. So really trying to figure out what you like and getting the experience with working with other coworkers as well, because I think that's really important once you graduate from school and having a real job. I would have to think about other stuff, but I would, Tiff, if you have anything to add.
Yeah, I was gonna say, like, didactic lecture wise, I feel like weren't super contributory to like helping me prepare to where I am today. I feel like if there's any P1s, P2s in here, if you guys want to get a head start, just get the NAPWORKS book and just read it through. You'll like get all the information you need from the 4 years of schooling. What really helped was just kind of like the extracurricular experiences, kind of like what Hannah said, like leadership roles, IPPE, APPE experiences. No matter if you didn't like them, it's still like I feel like it added way more value, because at least then I'm like, oh, I don't like this, versus like in lecture it's like, oh, I don't like this lecture topic. It's just a different kind of like perspective, like in overall. I also feel like having a mentor really helped me, like having a good mentor, like someone that you can actually just go to and talk about anything. So for me, that was like Dr. Wenzer, like, and it really helped that he was in infectious diseases. So I think, and because I was really interested, I really looked up to him. But I feel like that doesn't necessarily need to be the case. You just need to find someone that you can really connect with, and that you can, like, go and just ask for advice, and then and just be able to talk out, like, maybe like what my future career paths are, what my options are, someone that's already, like, in the pharmacy field that can give you a different perspective, that now that they're on like the other side of being a student. So definitely having a mentor really helped me. And then working also helped, kind of like just the whole, being outside of school, the extracurricular experiences, because I just feel like interactions in the real world are just so much different than what you can get from lectures. So definitely for me, mentorship, IPPE, APB experiences, jobs, extracurricular activities, just not sitting in a lecture hall, really.
The next questions we have is, what advice will you give to students that are interested in pursuing residency in the future?
Kind of going along with the academic work from school. I've seen students who get 4.0s in their exams, or who only looks into like exam and only study like what your lectures and stuff, and not really looking into like jobs or taking on any extracurricular work, such as leadership roles. I think GPA is an important factor when you want to pursue residency. But as a PGY1, as a PGY2, we get to look into residency applications from students, and their GPA at baseline in average are all good. Good meaning they all have over 3.0, or maybe their average like 3.4, 3.5. Having a 3.4 GPA compared to someone with GPA of perfect 4.0, but with no other extracurricular or activities or jobs on side of that, while comparing that to a 3.4 maybe with other work experience and research experience and extracurricular activity experiences. For us, I think it's more interesting to talk to the person with more experience with that GPA. So what I'm trying to say is, yes, grades are really important, but school is not just about GPA. Really at UIC, compared to other schools, it offers a lot of stuff. There's a lot of research opportunities that faculty offers. Isn't there an elective for research as well? Take advantage of that. Take advantage of all the mentorship that you can find. The thing that I realized when I was interviewing a student who was applying for PGY1 last year was a thought was, what if they really had a good mentor to give them tips on how to do interviews or give them tips on how to write a letter of intent? What if there was someone who can really help them and give them tips on how to do it right? Because I think they're wonderful candidates in person if I look at their CV, but if I meet them in person, there's something that I would have given them tips on, or maybe, fix in the future to kind of, not do them anymore during interviews. So like Tiffany said, I think having great mentorship and really taking advantage of all the organizations that are offered through UIC. There's a lot. And there's so many leadership roles that each organization has. Like I think APA has like eight positions or something. And then each organization, I don't even know how many organizations are there at UIC now, but if you really add those up, there's a lot of leadership positions that you can take advantage of. And really just break out of your shell if you're too shy, or if you don't think you're a leadership type, just break out of the shell and try. I think just, like Tiffany said, I'm honing on leadership, work experience, research experience if you have to. And really just trying out different fields of pharmacy rather than just sitting at your desk and studying for an exam. That's all I'm trying to say.
I agree. I feel like grades don't matter. Everyone's gonna come in like ROCI, PLS, 3.5 above GPA. It's like, yes, you have that. So does like 90% of the candidates applying to residency. I feel like what you should really hone in on is like everything you're putting in on your resume is fair game to be asked. So you better be like, you better know what you're talking about. You better enjoy what you're doing because they will ask about it. And if you were just doing it superficially, like just to have it on the resume, they can tell. They can tell people that are actually passionate about what they're doing versus someone that are just, it's a resume builder. And so like that's something to keep in mind. Also, residency is hard, kind of like what I said before. It is a steep learning curve. You have to just accept that you don't know everything. You may feel like really dumb at times, and you just need to accept that it is a year for you to learn. So you have to be humble about it. You have to have a good attitude about it, and you just have to have the mindset that this is going to be a very hard year, but you will come out just a lot stronger, a better clinician on the other side.
I have a few more things to add. As a PGY2, I precept students a lot, and if there's any P4 students here who are really interested in residency this year, I think it's going to be more tough and more competitive this year just because everything's virtual. Before, if you go to mid-year, I tell students who are applying to residency, say like, hey, you're there for mid-year to cut down the list of programs that you're interested in. Go talk to the RPD, go talk to the PGY1, and get a feel for what the program is like, get the feel for their personalities, get the feel for if they really have the value that you want from a residency program. And if you don't see that, like, delete that program from your, list of all the programs that you want to apply for. That was my general tip that I would give for a P4 who's going to mid-year. However, because it's virtual this year. I really don't know what's going to happen. I mean, UIC is talking about how we should do our mid-year programs, but everything's up in the air. Even for interviews, I feel like it's hard to really get to know someone through virtual interviews rather than having them come over to a program to do a face-to-face interview. So I think what comes down to is your letter recommendations from your preceptor. In general, I think that's really important when we are looking into applications. What did the preceptor describe you? What did they say about you? And as a student, on their first day of rotation, I always ask them, are you interested in residency? And if they say yes, then honestly, my standards for them are a little bit higher than those who are not interested in residency. I tend to stress them more about patient care, or how did you come up with your recommendations, or what are you thinking about these patients? So if you are a P4 right now interested in residency, I encourage you guys to really work hard, really show that you are interested in residency. And if a preceptor gives you feedback about something, take it by heart and try to, fix, or try to really take that feedback and do it better, because I think letter recommendation in general is very important, and I want to see that from you because you are interested in residency.
I agree wholeheartedly. Having a very good connection, or building that connection with your preceptors, is very important. I had a preceptor last year when I was on my cardio rotation, and who ended up being one of my letter recs, and I had actually sent him like my list of programs just to get like his feedback on it, and he was like, kind enough to actually rank them for me, like the top tier, mid tier, and like low tier programs in terms of like what he thinks like I would be able to like aim for. And so it's just like those little things. If you just put in that extra effort and show that you care, and show that like you're making that effort to like be better, to learn, and with your preceptors, they can see that too, and then like in return, like they'll just be more like willing to help you succeed. So
the first questions I have is, what's your involvement with APA? As mentioned, you're the past president, and why did you choose to be involved with APA?
I think it's just I wanted to help out. I wanted to get to know and help out Asian population. I think that's the main thing, because I'm Asian. I think that's the most simple reason. I applied to become a P1 liaison, which I didn't get it, but it's fine. I was still involved. And I really liked the value of what APA does to the community. Doing volunteer work at Chinatown, doing like food distribution and all those things. And I think that's a very unique thing that APA does in the community, and I loved it. So
similar to Hannah, and also AP used to do a dim sum social, so that's what lured me in, with with good food. And then afterwards I was like, oh, I really like the people in this organization, everyone was really chill, and then I got to give back to the Asian community. So that's why I was involved. And then I was the P1 liaison, and then I went on to like professional chair, and then
Okay, so the last questions we have for you guys is, what are your future plans?
so to the P4s in the chat, I will be going through the match once again to hopefully do ID for my PGY2. So I'll be like PPSing, but essentially it's like going through the interview process, going to do the match again.
yeah, for me, finding a big girl job in the ED and really, practicing my skills.
If you guys have any other questions, you can just shoot me an email, and probably Hannah will be the same way. Just like shoot us an email. If you have any specific questions about this specific residency program we're in, I'll be happy to answer any question.
Yeah, Peter, to answer your question real quick.
Peter.
Any elective you guys recommend for students who are interested in residency? Nothing really specific, but I do think UIC offers a lot of electives. I remember peds, there's even toxicology, there's critical care, there's pediatrics, there's bunch of specialty electives that UIC offers. If you are really interested in residency, like why not? I would take them. I took critical care. I loved it. I think they're super helpful for what I do. But do you have to take it to get into residency? I wouldn't say no. I would say no. But if you are interested, why not?
Yeah, same. It's like optional bonus. Also, those lecture slides would kind of help because I still sometimes do reference them from the lectures I took, but it's just like for a good general understanding.
Anyone else have any questions?
I have a question. Did you guys ever feel like you were doing too much during school? And if you did, like, how did you know what you might need to cut out?
I felt like I did a lot, but everything I did, I loved. So I was in APA, I worked in the ID lab, I worked at like Walgreens, I was in other organizations. And then at the end, when I was kind of like feeling overwhelmed, I just kind of like cut the thing that I enjoyed the least, if that kind of makes sense. And that for me was like Walgreens. I just cut down my hours, but I still wanted that like community experience. So it was just in terms of like kind of like seeing what my priorities lie, like where am I trying to go into the future. And so because I wanted to be inpatient, I was like, well, community is important, but it's not really important as the other things that were on my plate. So I kind of just like slimmed down on that.
Yeah, I think I'm similar to Tiff, where I was, involved in organizations. I worked at 2 different Walgreens store, and I also worked at inpatient Jesse Brown. So I think when I became a P4, I was a little bit overwhelmed just because I have to go to rotations in the morning and I have all these topic discussions that I have to prepare. And I knew that I was interested in residency, so I took all the rotations very seriously as a student. So by then, I needed my weekend to really, work up my patience. I need to work on my topic discussions. So that's when I let my community job go. I was thinking about letting one store go first, but I actually dropped both just because I knew that I was not interested in community. So it comes down to what your priority is and what you think is important during that time of your life.
I have a question. What about recommendations? How many did you get and who were they from?
Like letter of recommendations?
Yeah.
I think the requirement is at least minimum of 3. And so I got 3. Like I don't even know if I had a backup. I think I just did the minimum of 3 because anymore I didn't want to be like really pretentious, but I found like a solid 3. Like I knew when I approached them, I asked them, would you be willing to write me a positive letter of recommendation? And then I knew I had done well on the rotation, so I was kind of like banking on like being confident in that it would be a good letter of rec. And then so I just submitted 3. I believe that is the minimum, right, Hannah?
Yeah, depends on the program, but it's mostly 3 these days. When I was a P4 student, we had this X5 rotation, which is kind of like unofficial, like shortened version of rotation. So for each rotation, so I had a total of 4 before I applied for forecast. I asked everyone for a letter of recommendation, including my X5 rotation, but I ended up not using that X5 just because I knew it was not, I knew that preceptor didn't know me as much. So 3, and some programs require to be really specific, like 2 from your clinical rotation and 1 from your job or something. So there's certain criteria that programs look for, but at UIC and Rush, I think it's just standard 3 letter recommendations, and that's it.
Yeah, like you can upload more than 3 and you can designate which one you want for each program. But I just use the same 3.
Okay, but you majority bank on kind of your APPs for a good recommendation?
Yeah, all my 3 recommendations were from APPs.
Yeah.
Okay. Thank you.
Memorizing the top 300 drugs for Form 411 was, I don't even know what the top 300 ones are. So I guess Not really. Okay, just learn to recognize the classes of drugs and the big common side effects.
I honestly don't think so, unless you're a genius and that stays in your brain forever. Like I said, it comes down to how you can search these drugs online instead of memorizing them, unless you're a genius. And then Deb's question, when is a good time to start asking folks for their recommendation? For me, from day one, I told them that I was interested in residency as a P4. So they would really, judge me at a higher standard than other students and really look into me as a potential letter writer. And then during mid-evaluation, I kind of get a vibe of like, oh, okay, does this preceptor like me or not? Am I doing well or not? Get a kind of like a vibe of what they think. And then for my final evaluation, depending on what they say about me, if it's all positive and if it's ideal situation, they would offer me to write a letter recommendation. But if that's not the situation, but they're mostly positive and nothing really alarmingly negative, then I would ask them during my final evaluation. I'd be like, I really appreciate all your feedback to me. Would you be willing to write a strong letter recommendation? So to answer that question, I think kind of get a feel of throughout your whole rotation and asking them at a final evaluation.
Yeah, same. I told them from day one of the rotation, or they will actually ask you in general, are you interested in residency? And then I was lucky enough that at the end of each one, they offered me, they offered to write me a letter rec. So then I was like, it saved me like, that anxiety of like, so can I get a positive letter rec and whatnot? So, but if they don't offer it, it doesn't mean, you did well or you didn't do well or anything. Just go and ask them, but make sure you just say it like, would you be willing to write me a positive letter recommendation?